If you are getting a spine surgery, there is a very good chance you are going home with a collection of metal screws and rods bolted into your skeleton. But what actually happens to that metal over the next 10, 20, 30 years? Will an MRI machine rip them out of your back? Are you going to be strip searched every time you go through the airport security? And is the metal secretly poisoning your blood? I am a spine surgeon, and today I am debunking the craziest myths about medical implants and explaining exactly what happens to the hardware inside you. Let's tackle the biggest fear first, the MRI machine. MRI machines use magnets so powerful they can pull a flying office chair across a room. So, if you have metal in your back, is it safe? The answer is yes, absolutely. Modern spinal implants are made of clinical grade titanium. Titanium is what we call paramagnetic. It has incredibly low magnetic properties. It will not heat up, it will not vibrate, and it certainly will not pull out of your bone when you get an MRI. You are completely safe to undergo diagnostic imaging for the rest of your life. Now, what about your next vacation? Will you trigger the airport metal detectors? This is where the science gets interesting. Traditional walk-through metal detectors use electromagnetic induction to find out iron and copper. Because titanium doesn't conduct those waves well, almost nobody with spinal hardware sets off the old school walk-through arches. However, modern airports use the big glass cylinder machines, millimeter wave full body scanners. These don't look for the magnets, they look for dense shapes under your clothes. Studies show that up to 40% of patients will trigger these new scanners, especially if you had a surgery from the back of your spine where the metal sits closer to the skin. So, tell the security agency about your surgery before you step in and prepare for a quick landing. Finally, the most serious question: does the metal rust or poison your blood? Titanium is the gold standard because it instantly forms a microscopic oxide layer when exposed to the oxygen. This creates an impenetrable shield that stops it from corroding inside your body. While the metal does experience microscopic wear over decades of your bending and twisting, your body tissues happily accept these tiny titanium particles without inflammation. In exceedingly rare cases, let's say less than 1%, a patient might have a specific metal allergy requiring removal. But for 99% of people, the metal becomes a permanent, perfectly safe part of your anatomy. Having metal in your spine shouldn't stop you from living a vibrant, active life. Subscribe my channel for more such spine science.